Coming to you live once again, as we do on Wednesdays, it's the John Grayson and Patrick McGrath Show, starring Dr. John Grayson and Dr. Patrick McGrath. Brought to you by No CD and Oval. No, not. I'm just kidding. It felt like an old.
You're doing good. I was impressed.
Thank you. And now here's Johnny Grayson. Yeah. All right, everyone. Good.
Which I haven't been called since fourth grade.
Johnny? Yes, I figured.
Johnny. Yeah, I was Johnny. I was Johnny back then.
Yes. Well, very good. Thanks for being here, everyone. Brought to you by No CD, an online platform for the treatment of obsessive compulsive and related conditions. We work with you here in the US and Canada, and also in the UK and in Australia. And if you're looking to use insurance, we take that as well, too. And you can also check out Dr. John Grayson at the Grayson Center out in California as well. And with that, why don't we do what we usually do? And let's read some questions and give people some irreverent advice, as we like to do. You're already reading ahead, I see.
Well, no. Okay, I was just trying to understand the meaning of "they never look pretentious when lions are chasing them."
Oh, I like to say it's hard to do complex math when you're being chased by lions as well.
Well, there's so many things that are true. I was wondering if it was you or an I who did not look pretentious, or someone else when lions are being chasing them.
I've never been chased by a lion, so I don't know if I would look pretentious or not being chased by a lion.
I have a suspicion about myself, but yeah,
I think I'd look like I crap my pants. That's a good possibility of what you might see. Yeah, but otherwise, and probably this face as well too.
I have some variation. Yes.
And I would only hope that I was the second slowest person in the group at that point.
Well, it's one reason to always smash. This is terrible. To travel with a small child.
Just bait, right? So, yeah. All right, let's see. Flex says, I'm suffering from sexual orientation obsessive compulsive disorder. When I think of stuff about sexual orientation OCD related thoughts or images, it causes sexual feelings, or sometimes it feels so real. Oh, my favorite statement has come out in the very first, the line 4 of the statement already. It feels so real. I'd love to chat about that a little bit. What is happening because of, I think it again and again. Is this happening because I'm obsessed, because I'm thinking about this image or thought? Well, can I address the first thing first, John, and then I know where you want to go with this, but
I'm content to
go. I want to take the, as we almost address every week, this notion of why does it feel so real, and the answer is because it has to feel so real. Because if it didn't, John and I don't have jobs, because no one would come into our office and say, "Man, this bothers me." But actually, it doesn't bother me at all, because it really doesn't feel real. So it's really not a big deal. And we'd say, great, what else is going on, right? If OCD is good at anything, it's at manipulating emotional experience. And when we have an emotional experience, we often attribute it to something going on in our lives, something that feels or seems or is real, right? So if, as we were talking about before, if a lion is chasing you, well, that's real. And you're going to have all of these feelings as well. Well, guess what? OCD can mimic those types of things. You can have the fight, flight, or freeze response. You can have shame. You can have guilt. You can have disgust. You can have all of these things happen. And in relation to these obsessions that you're experiencing. And so, of course, it's going to feel real, because in our day-to-day lives, it would be weird probably to have such an emotional feeling towards something when there was nothing there. And so we kind of take a look at OCD and say, well, this thought then must be real, because I only have these reactions to quote unquote real things. But guess what? You can have those reactions to thoughts and images and urges as well too. Don't be fooled by OCD. This is what OCD does. It is the great manipulator, and that is the way that it works.
Not surprisingly, I have something to add.
I would be shocked if you didn't.
This is I'm really excited because I think I haven't used this story ever here.
Oh, Well, good, because we
Because
could use a new story.
I
Yeah,
know I've been saying the same
yeah,
thing all the time.
yeah, yeah.
There is
Mhm.
another reason it feels real.
Let's go.
And it has to do with the fact that as human beings, we're probably wired wrong because emotions really come from a more primitive part of our brain, and kind of this reptilian part. And you need to understand reptiles a little bit. Primitive little dinosaurs running around, they don't really have any cortex to think. Like emotions are the things that have them motivate them to do anything. So, there you are, some small little dinosaur, and Tyrannosaurus comes thumping in, and you don't think it's dangerous. You have this automatic response, ah!
Mhm.
And you run.
Mhm.
Now, it really turns out it's useful
Yes.
if I can learn to associate that. So, it's useful if I hear the thumping of the dinosaur,
Boom,
so
boom,
I can get that
boom,
ah! And
boom,
start running
boom,
right then.
boom. Mhm.
And that part of our system is still there. So we have
Yeah.
these like two systems. We have our emotional system and our logic, and they're actually pretty separate. So it's almost by definition, feelings seem like they reflect reality, and this screws up everyone.
Mm.
This is why people stay in super crappy relationships that are horrible because they feel like they love the person. And you know what? They actually have those feelings, but is it actually represent love? Which, of course, goes to the second part of their question. It's like, okay, my feelings are real. Oh my God, does that mean? And we know that if you think about sex, if I focus on if you focus on your body, if you focus on an area, you will have sensations, i.e., feelings, and they will feel real. And in fact, I could write a sex scene that would go against what somebody is interested in.
Mhm.
Uh, and I can write it in a way as to make it arousing, even though they're really sure they are not whatever I'm writing the scene for. And so all we know is, yep, you're having arousal. Does this mean you are X? Well, here's the closest I can get to the answer. If you don't have a current conscious plan to engage in X, then I guess you're not. And even if you were to tell me you have sexual fantasies where it seems like it's a really exciting fantasy, like I wouldn't really want to do it, but the fantasy is really great. It'd be like, okay, that doesn't tell me anything. It doesn't tell me if there's a true self or something. It's like, all right, you like, because plenty of people are known to have sexual fantasies over things they would never actually want to do. So,
That's why they're called fantasies.
oh, that's damn, yeah. So, if you're until you're planning to engage in it, it's like, okay, you have those thoughts, and of course, I always like to point out you could be everything. People are like, what if I'm gay, or what if I'm straight? It's like, what if you're both?
What if
And
you're bi? What if you're trans? What if you're who knows?
right,
Mhm.
right, and
Mhm.
I can be one of those things and decide to go for second best.
Yeah.
Anyway, okay, I think we've beaten that into the ground temporarily.
Yeah, I think so too. Um, and then just the other piece. I just want to talk about fear for a second, John. That it is easier to learn to be afraid of something than it is to learn to be safe about something, right? Because I don't think our species would have survived if it was the other way around. If if we went into a cave and saw the saber-toothed tiger and said, "Oh, what a pretty cat. I think I'll go pet it," we became lunch. But our ancestors who saw those teeth and went, "Ah!" and got the hell out of there,
Mm.
well, guess what? They lived on to propagate their genes to the next generation, and then the next generation, and then the next generation. So we are ancestors of people who have been afraid of everything, basically.
Or as I like to say, because it's one of my two family mottos,
Yeah.
only the paranoid survive.
There you go. Yeah. Hmm. Yeah. That's that's the Grayson family crest, by the
It's one of them. I'm not going to share the other one right now.
way.
You can ask me later.
Oh, let's get later. And of course, Flex, what you also bring up there is what I always call the pink elephant effect. And there's my
Oh,
pink elephant
nice. I like
almost
that.
always at the ready, right there at my desk, which is the more you hope not to think of something, the more you're guaranteed to have that thing pop into your head as well too. So um, if you go into any kind of sexual experience or see someone who is not the identity that you are afraid of, or anything, or is the identity you're afraid of, or something like that, you're going to hope not to have any of these thoughts, which is only going to guarantee that you are going to have these thoughts or images or urges, and therefore have to do, then you feel whatever compulsion is necessary to try to prevent this thing from magically occurring. That suddenly we would woof and just change who we are,
Right.
and our identities and what we believe in and all those kinds of things too.
And the really important thing that you're bringing up is that if it's possible for me to change overnight, well, the rituals aren't going to stop anything.
Yeah, right. I mean, yeah.
All it's so like, well, what is the truth? I will just have to wait for it to become obvious. Like
Yeah.
I'm currently planning on continuing to live as if I'm a straight guy, and
Yeah.
Kathy likes that idea,
Yeah.
but
I'm planning to wake up as a turtle tomorrow, actually. So we'll see how that happens.
orangutan is my preference, but
I mean, I'd like to be an owl. If I was going to be anything, owls are really cool, I think. But that's what you
they're
go
like the
with
hippies.
orangutan. Okay.
They're the hippies of the animal
Well,
kingdom.
you are a hippie. That's true.
I am an old hippie.
You'd be
It may
the
not be
only
obvious.
tattooed orangutan in the world. Yeah.
All right.
Let's go on. Jack says, I'm obsessing about whether I can think or not. I love when people type something but wonder if they can think about things. That's always just a fascinating discussion right there about OCD, right? I find myself comparing intellectual levels with others and keep saying to myself, maybe you could have thought that if you didn't have this problem. I keep belittling and shaming myself for this problem, leading to feelings of inferiority in social situations and leading to problems in academic pursuits. Basically, this is consuming my life.
I'm feeling sorry for you, Jack, for real, because it's you're probably unnecessarily miserable.
Mm-hmm.
Um, uh, you know, if there's no way to know if one is smart, when I think of the things that I push and say, and I believe in them, and I have the feeling I'm right, and I go with that feeling because it serves me. But do I know I'm right? Like, what's the evidence I'm right? So okay, a lot of people agree with me, and there are a lot of people who really think I'm fantastic. But you know what? There are other people who are well known, and people believe what they're saying, and I think they're idiots. So I actually have no way of knowing of like, hey, I'm really saying great stuff, or I'm an idiot and I'm just very successful at misleading everybody else. So I don't get to know. So I feel like the comparisons, and as soon as I compare myself, well, I think I'll always lose just because, why can, what's, I'm better than some people, I'm worse than some people. Um, why does it matter? Like, okay, I am whatever I am. And how about if I just enjoy talking to the people I talk to, and in terms of like, I'm not sure what thought you would have liked to have had that you didn't have because you have this problem. I do think there's a little bit of truth in that, in the sense that not that you have OCD and that prevents it, but that you decide to focus on this comparison and hey, you only have so much bandwidth. So, okay, if I'm trying to judge whether my thoughts are smart or whether I'm as smart as them, or could I have thought of that? Well, that's time that I'm not thinking about something that might be more fun. I'm really fun driven. So, it's like, and I think if I have, an OC problem like you have, initially I'm stuck doing two things. It's like, yep, the thoughts are screaming. I want to keep judging them, but like, what would I rather be thinking about? And you know what? I can't suddenly sit down right now and say, you know what? I'm going to have some smart thoughts right now.
Yeah.
Because like I think I need to have some really cool, intellectual, brilliant things come out of my mouth,
For the next
and
24 hours, only smart things will pop out of
I'd
this
be
mouth.
I'd be happy if we can pull it off for this hour. But but if I think of it in terms of like I got to think smart things now, it's like I'm dead seriously. I don't know what to think about. Like, well, okay, what's the smart thing I to think about? Now, you give me a prompt like you guys are giving me. Okay, I can go off and answer that prompt. And just because I've only been working with OCD since 1978, um, it's not hard for me to come up with really good sounding stuff because it's a long repertoire. Um, so I feel like you're sadly hard on yourself, and I think it's probably equally true that you have a problem besides OCD. I think that you have. I have a suspicion, and I know you're not answering, so I'm going to just tell you what I'm thinking you're doing. I have to guess that I have to get at my iPad. I have to guess that if somebody gives you a compliment, I'm wondering if you do one of two things. Sorry, look at my iPad, who's just being difficult right now. There we go. If you tend to think that getting a compliment, either they're just being nice to you and they don't really mean it, or they just don't know you. So so that I think you might do that with compliments, but if they say something not nice, you kind of take it seriously. Now, if you do that, you've heard of wearing rose-colored glasses, seeing the world nicely. You wear that come up
Crap covered glasses. There it is. Yes, we
right
see it. Yes.
because think about it. You're impossible to compliment because all compliments are
Mhm.
rejected. Everything. And so, I'm suspecting, even if I'm not quite accurate on that one thing, your self-esteem is crappy.
Yep.
And, when Patrick and I are working on a self-esteem problem with somebody, our view is they have a messed up way of looking at themselves,
Mhm.
as opposed to your view, which is, I'm looking at what you wrote, in which case you kind of think you're defective. And, so you're feeling like, well, treatment's going to turn you from this defective human being into a human being. But I'm going with the first guess
Yeah.
that, no, you have a messed up way of thinking about yourself. And this problem is actually worse than your OCD because your OCD, you think that's nuts. The self esteem stuff you actually believe. And of course, for you, there's an overlap because your OCD, it's not always tied into the crappy self esteem, but your OCD and your self esteem problem are kind of merged because both are happening together and they feed each other. Um, So it is true. I don't know you.
Yeah.
So but I do believe that your crappy self-esteem isn't warranted. Um, and I really feel anybody with a problem, unless you think you somehow caused it, which Patrick and I don't think you did, it's like, okay, the issue is getting out of this problem and not to make you better. I'm never trying to make anybody better. Because that assumes like they're defective. My goal is the only reason I get rid of OCD is it makes my life easier to live and it makes my life more rewarding. It's more fun. So we're not trying to create a decent human being. We're trying to create somebody who gets to enjoy the things they can do.
Tonight's show brought to you by Crap Covered Glasses. Yes, by Grayson Industries, featuring really runny crap or very dark crap, depending on how you like your crap or something like that. Yeah, we could do
Or
that.
how you crap on yourself.
How you crap on yourself. Yeah. I've always said if you really want to anger someone who's anxious, give them a compliment
Mm,
because it almost sets up for them. Now you must achieve this in order for me to like
mm.
you. And if you don't achieve that, then you've failed.
It's a funny difference between my wife and I. She
Mhm.
does have good self-esteem, but right, compliments always kind of like she feels this pressure now I have to live up to it. I'm
Yeah,
kind of, and I'm always saying, all right, Kathy, if somebody compliments me, I like it. But if they think I have to live up to that, they can go screw themselves.
exactly.
It's like I'm sorry,
Exactly.
I am under no obligation from that.
No.
But
And
yes, but you're so right.
It's true though. I mean, especially in social anxiety as well too. I mean,
Yeah.
I remember even working with someone who was complimented once on a paper in grade school, and by high
Mm,
school was failing every class because was so afraid to turn anything in, because what if they didn't think it was as good as that grade school paper was, right?
right.
Just fascinating. The other thing that's on here is is this idea of maybe you could have thought that if you didn't have a problem. One of the things that I like about us doing this together, John, and also going to conferences, is I love going to other talks to learn about how people talk about OCD and maybe get an amazing little twist of phrase, or like, oh, that example. Wow, yeah, totally stealing that. Now, the fact that I didn't think of that example, does that mean that I have a brain problem? Or does it just mean that all of us could look at the exact same thing and have totally different ways of describing it, interpreting it, experiencing it, all of those kinds of things? And does that mean that there's something wrong, or does it just mean we're all unique in the way we view the world?
Well said, because I have said a bunch of original things,
Yeah.
but I also have merging things that I've stolen.
Yeah.
I think the main thing I can say about the things that I've stolen is I present them really well. But but there's a mix, and
Yeah.
if somebody want to know, like, did you make that one up? It's like, no, no, I took that one. I don't need to claim credit for all of them. But it's like, right, this is a useful metaphor, story, or whatever. And so, yeah, I'm a mix of both. And again, I honestly, all right, say something really smart right now.
Yeah.
I don't know what to say, other than, I'm just going to jump to OCD and ignore it.
Yeah.
Yeah.
Valentina says, is it true that ERP is the best tool for changing faulty beliefs in OCD? I'm convinced that my cleaning rituals keep me safe. I just wish I could do them more efficiently. I see others as too careless. It's interesting.
Before you answer, sorry, sorry, but I just want to answer the first part of the question, and then we can go on. And the answer to the first part is no. Okay, go on.
Okay. And I love that in the first sentence, they're called faulty beliefs, but in the second sentence, they keep me safe. So I'm just wondering how a faulty belief keeps you safe. I'm just curious about that, because that's fascinating to me. But go ahead and elucidate on your first answer, John, please.
We're not trying to change faulty beliefs.
Right.
The issue is, I mean, your cleaning rituals, in terms of keeping you safe. If we were to talk about them, I have a few beliefs that I might be wrong with, because I'm not certain about anything. One is, I believe that I can find the flaws in your cleaning ritual, so that whatever your ritual is in your method of preventing it, I do believe I can find out how you're actually violating your own rules in places, so you're not really doing them correctly, and really you need to get way more crazy in your behavior than you do now. Secondly, in terms of keeping you safe, and if we look at the actual world, what is the percentage that they're increasing your safety? So, and of course, we don't necessarily have data. So I believe you feel like they make you safe. But, in terms of, is everybody else who's not doing your rituals, are they all like dying, getting sick at greater rates, or what? And Patrick and I are probably proof that actually exposure to all kinds of horrible things might build up a resistance, because I don't really get sick. And,
I don't either. Mm.
yeah, since 78, every week my hand is going in dumpsters and toilets and in my mouth and other places. So, I
It
really
went
look
in my
forward.
mouth once too, even at a
Yeah,
conference.
that's
If I
right. And, yeah, yeah. And and they talk about the microbiome, and I
yeah.
actually sometimes think I'm waiting for the patient to come to me where I say, nope, you can only go in the dumpster once this week. You can't go in more to try to improve your microbiome. So,
Mhm.
so we don't really know that. But then we get to the real reason for treating your OCD. You have two choices. You know how life works right now doing OCD. And I would argue that however safe your rituals keep you, they don't really work that well, and you're always unsafe. I mean, I can go through a zillion ways your environment is contaminated in ways that you cannot even fix. But so there's that versus what would life be like without OCD? So it doesn't matter if you believe your rituals keep you safe. Do they keep you significantly safe compared to how your life is? Now, I think when you say you want to do them more rich, efficiently, in my mind, that's telling me you're trying to be 100% certain you've done it just properly. And it turns out that research has shown us the only people who are 100% certain are stupid. So we can help you get stupid. So we can help you live in a world and have a better life. And you know what? Whatever you're fearing might happen whether you do your rituals or not, because your rituals, even if your rituals keep you safe, they can't be 100%. And whatever they're keeping you safe from, there are probably other things you're not scared about that could affect you negatively in the same way. So your choice isn't so much changing your belief. It's like, you want to live a life like this. So what we can help you do is we can help you learn to live with that uncertainty and to learn with like, I hope bad stuff doesn't happen, but I'll cope with it. But changing beliefs. All we know is that I would suspect that your cleaning rituals don't significantly change cleanliness, or the dangers you're avoiding aren't significantly high. Otherwise, everybody around you would be dropping dead or getting sick or whatever other thing you fear. I don't know if that answers everything.
Here's the other piece that I've thrown at people as well too. So you talk about you see others as too careless. So let's just say others get a cold twice a year, and that cold lasts for 48 hours, right? 2 days.
I
We'll
was
go
going 2 weeks, but go on.
like the bad symptoms of it, like the 2 days where you're just feeling really drained. You've got the prodromal and the after effects, yeah, but we'll go with that. I'm wondering if you look at the time spent on rituals, I'm going to bet if you add that up over the course of a year, it actually is more time spent doing rituals than the time that you would have been down for the count from being sick from a cold for those 4 days. And then maybe some of the crappy that you feel pre and post. So I kind of also look at the odds a little bit as well too, and think, you know what? I'm going to live my life, and I may I may be down for the count for a day or two. Although, like you, John, I mean, I haven't taken a sick day in 19 years. So uh, I'm a full believer, like you are, that my being exposed to things has probably kept me in pretty tip top shape, actually, in terms of my health.
I
So,
might have a total of about 8 days since 1978.
okay. Yeah. So, you know, and we have done this at conferences. I remember the one of our first talks together, I was chewing gum and you put your hand out and said, can I have your gum? And then you chewed it for a while, then you handed it back to me, then I chewed it for a while, and then we drank each other's water bottles and all sorts of things. So we share a microbiome together, John, which is
Mhm.
lovely.
It's why I feel so close to you.
Yes, exactly, our bacteria or what the all right, Shay. Why do I feel like I'm never going to be anxiety free? Well, because you aren't, because you have an anxiety system. And boy, I'll tell you what, I would never want to be anxiety free, because I would then just step into the street and probably get run over by a car. I know that our fight, flight, or freeze response is actually something that helps us. And if you want a fascinating review of this, and I don't know if you've listened to this, John, but have you listened to the show Invisibilia?
No.
Podcast from National Public Radio. Season 1, episode 1 and 2 are on fear. Episode 1 follows one of our colleagues, Tom Corboy, and a
Mhm.
patient that he has who has intrusive thoughts about what if he were to stab his wife after watching the movie Brazil, which is a very violent movie. And episode 2 is about a woman who has this rare genetic condition that only 50 people in the world that we know of have, where her amygdala has calcified into a stone, preventing her from ever having a fight, flight, or freeze response ever again. And she no longer has an anxiety reaction to anything. And many anxious people would talk about how great that would be. And she described that it's really not. It's not a great way to live. And in fact, I am always fascinated when people say that they don't ever want to feel anxiety, because I don't think you really understand what you're saying when you say that you want to be free of all anxiety. So,
And I
anyway,
think the other thing Shade is talking about, I mean, she's actually talking about a form of OCD that we don't often talk about, but we see.
Mm-hmm.
Uh, and it's a really nasty form because her whole goal is to not have anxiety. So she's constantly measuring everything by, is she anxious or not? So she is never working on trying to cope with anxiety. She's always working, everything is measured by, am I feeling it on everything sucks? And I once had a client who had a very similar problem. And part of the assignment I gave him was because I was working on let's cope with anxiety, and also let's learn to be mindful. And in this case, what I gave him an assignment. I want you to watch a movie, and I want you to tell me whatever you enjoyed in the movie, but I don't mean enjoyed the way you should.
Yeah.
I
Mm-hmm.
like it just 5%. Because I also point out that sometimes when we're talking in the session, I make them laugh. And it's like, see, you laugh. Now, I understand that a 2-second laugh in the course of life is not like my goal, but did you even know that you did that? So I gave him this assignment, report back just in the parts you enjoyed, no matter how little. The guy comes back and he says, it didn't work. The whole thing sucked. I was miserable the whole time. I'm like, huh, all right. And I asked him to tell me about the movie. So the person starts talking about the movie, and it becomes clear that the individual really liked the climax of the movie. So in a kind of very lawyer fashion, I'm getting him to feed me the details that he's really like it. Oh, that was really cool. And it's like, oh, you're glad you saw that part. Yeah, I said, okay, you didn't do my assignment. You clearly enjoyed this at some level. So I'm sure there was still anxiety there. I'm sure it wasn't perfect, but I said to do some enjoyment. This is so critical because if I didn't point this out to you, your memory of that movie is that the whole thing sucked. When in reality, it did suck, but there were these good parts also. And if I'm going to learn to cope with anxiety, those are like little islands I need to learn how to do both at once because mindfulness is being in the state of and, not or. Not like the movie was great because I wasn't anxious or it all sucks because I was. Mindfulness is like I'm learning to do both at once. Whenever we say, and I hate this phrase because I think we have to teach people when they say, oh, let it be there. Well, that's something we have to teach you how to let it
Mm-hmm.
be there.
Mm-hmm.
But letting it be there isn't this like nice, like, oh, it doesn't matter. It's that it's there painful. But at the same time, I can enjoy something, while that's going on. And so, no matter what the situation is, I can be feeling these two things at once. Now, I think treatment is not so simple, Shay, but your current goal of being anxiety free interferes with ever getting better because really all of us have to learn to cope with anxiety. If I change my what I choose to cope with anxiety. If I want to be anxiety free, sooner or later I am doomed because I'll start feeling anxious. I'm going to keep focusing. And it's like,
Mm-hmm.
stop
Mm-hmm.
this. And God forbid something actually happens that I really am anxious. And now how am I going to cope with that? So the goal is learning how to cope and how to live with it. And we think it's quite likely that your anxiety will be less and less. But the measure always has to be on how am I improving the rest of my life while this crap is going on versus it has to go. Um, so you're right. Your approach is defeating.
Mm-hmm. Mm-hmm. Yeah. So many. We could spend an hour on this one, I think, just discussing, this. I I've often talked to people too about the idea that sometimes to be pain free, quote unquote, because are we ever really free of physical pain? There's always an itch or something, we probably have. Sometimes you have to go through more pain, like a surgery, in order to have less pain, right? And in this situation, I think sometimes there's a fear of people who have anxiety to allow for the anxiety to be there and to learn how to cope with it, as you've talked about, to learn to be with it, which is a difficult concept for people. I agree 100%. It is a skill that has to be taught. But maybe the the controversy here, maybe the very fascinating piece of all of this, is that when you learn that things don't have to be anxiety provoking, as right now they are perceived through the lens of obsessive compulsive disorder, or the crap glasses, right? If when you see life through there, then is it even possible to have any kind of feeling other than anxiety? And when you take the glasses off and you learn that you can actually handle that experience, handle that anxiety, and you haven't set yourself up with the only way to feel good is to feel nothing at all, right? To be absolutely no feeling. Well, uh, I think that's where people make the mistake, and that becomes the goal that they have sometimes going into treatment, is they're going to teach me how to feel nothing at all. And no, that's not the case. We're going to teach you to live with whatever the feelings are that you have and not be bothered by them in such a way that OCD is going to use that against you and manipulate you into doing compulsions. That's what we're going to do.
I have two I want to go to. I think they're
Okay,
kind of potentially
give me
good.
a time and I'll jump. Mhm.
Just Piano at 11:33.
Okay.
So
Oh my gosh, people were really coming in early on these things, weren't they?
so Just Piano. I want you to recall, because Patrick and I weren't kidding. I go in dumpsters and I stick my hand in dumpsters and look for wet stuff and put my hand in my mouth. And at the OC conference, I run a thing called Road to Recovery Tour, where literally I take 200 to 300 people out, and they don't have to, but they're encouraged to do everything. And we all stick our hands in the dumpster or sticking our hands in our mouth. Is there something bad in the dumpster? Quite possibly. Why do we take that risk? We're playing the odds. Everything in life is the odds. Low odds are not no odds. So I'm not saying it's completely safe. Nothing is completely safe. All we have are the odds. So, yep, maybe your neighbors put something toxic in there, but we're going with the odds. And we have two. This is what I said to the earlier person. We have two sets of odds going in place. Your life, the way it is being OCD, and your life risking getting something toxic. And yeah, actually, the assignment would be, yeah, go in and spread it everywhere around the home. I would actually have you go in there, take something that looks nasty in it, put it in a spray, put it in a spray bottle, fill it with water, and spray everything in the home. I love the spray bottle. It's
You
like
do love a good
open up
spray
all the
bottle. I
drawers and
know
just go.
you love a spray bottle. Yeah.
But
Mhm.
so yeah, it's potentially risky. I don't know what's not risky. Life is risky. You know what's more risky than sticking your hand in their garbage? Driving a car. Because you don't, as scared as you are of this, you don't often read about people got sick from garbage. I mean, I'm sure it happens, but you don't often happen. But you really frequently read about people dying in car crashes. So technically, if you're going to make sense, stop driving. I mean, it is true if you stop driving, that you won't be in a car crash in a car, but a car might hit you. And, even if you're walking a sidewalk, it doesn't mean a car won't jump up the sidewalk. So there's nothing doesn't have
Even
some
if you're in
level of
your
risk.
home, a car could crash into your house. That
Yeah,
happens sometimes
actually,
too.
that happened to a partner I had many years ago, and it was in a weird. A car came through the living room window. Nobody got hurt, but it was pretty. It was in retrospect. Besides the pain of it, there was a certain humor they had to the adventure of that story. So,
Mhm.
yeah, there might be something toxic there, and yes, we tell you to spread it because you know you're stuck with living with risk. or not living. In fact, there's this wonderful book, and it's not a nonfiction book, so it's not like this is a therapy book. But I love this quote that I stole from the book. Uh, Maybe it was like Dr. Sanborn said, certainty was just a story the mind created to defend itself against the pain of living, which meant, almost by definition, that certainty was a way to avoid living. You could choose to be certain, or you could choose to be alive. I know you would like a third choice there, Just Piano, but there probably is not one.
Mm-hmm.
Mm-hmm.
I like that quote.
I know, isn't it great? Oh my
Where's
God,
it
I
from?
love it. It's from a book called Wellness by Nathan Hill.
Thank you, Nathan.
And it's pretty cool. And by the way, you'll like it. One of the characters is a psychologist, not a very healthy one. I felt like she was stealing my research from the 70s. No, because she was misusing it, but you'll see it was somebody taking psychological research and misusing it.
Mm-hmm.
And all the characters are wonderfully messed up. And that is kind of the conclusion of the book. Doesn't give anything away, but
Mm-hmm.
So Taylor,
And the next one, Taylor.
the next one.
Physical
Patrick,
things I love are starting to get associated with bad thoughts I have. Now my favorite objects will give me bad triggers of the thoughts I've associated them with, and I throw them away. These objects and thoughts are also associated with past trauma. It's been a nightmare. Just so you know, I always read the things because I have a friend who is blind, and it always annoyed him when people would have these kinds of shows and they wouldn't read the question, so he wouldn't know what they were talking about. So he's no longer with us, unfortunately, passed on, but in his honor, I always try to read the question as well too, just in case. So.
And you have to start with this one, Patrick, because this is one of your favorite themes. Think.
All right, let's go back. Physical things I love are starting to get associated with bad thoughts I have. Now my favorite objects will give me bad triggers and thoughts I've associated with them, and I throw them away. Yeah. What fun story. I was treating somebody once who I called from the hospital. They were in our intensive program. And he picked up the phone and I talked to him, and he came in very angry at me the next day. And I said, "What's wrong? Why are you so mad?" He said, "I had to throw my phone away last night." Okay, why? Because I don't want to associate anything at home with the hospital. And since you called me from here last night and I picked up the phone and I talked to you on the phone and you were here, that made my phone at home associated with the hospital. So I had to throw it away. And now I have to spend $100 on a new telephone. Now, think about that, everyone, for a moment. Right? Suddenly, I'm being blamed for the fact that he's throwing out his telephone. Now, this is, John is correct, one of my favorite things, because I call this cooties, right? This emotional contamination type of thing that starts to happen in these situations. It's not the kind of contamination where John would get a spray bottle, but potentially, because we could still figure out a way to do it. I could figure out a way to do it. You could take a rag into an area that is emotionally, or sit it on a chair of someone we hate who sat on that chair. Now that chair is contaminated, and then we could take a rag and touch it, and then we could soak that rag in water, and then we could drain that rag into the spray bottle, and then we could know that
he's got favorite objects. We can put one of his favorite objects in the bottle or a piece of it.
There we go. Yes, absolutely. And this means a belief in what we did in grade school, which was cooties and cootie spray, right? If somebody had cooties, and every day in our grade school, there was like this new person had cooties that day, didn't matter who you were. And you would go like this, shh, and you'd have your pretend cootie spray, and then you would be protected from the cooties, right? Now, did anybody actually believe that? Well, no, but hey, what if, right?
I believed. I never got cooties.
Well, because you use cootie spray.
There's the proof.
That's why you love spray bottles to this day, because you literally did cootie spray, right? And so here in these situations, yes, you have this idea that even if this thing is associated with a past trauma or nightmare. So if this is the case, John, I should sell my red car. And I should also sell my house because this is the house I lived in while my wife was dying for 6 years. And so this house has a lot of shit memories associated with it. And my red car is the car that I was driving downtown Chicago in 3 years ago when somebody cut me off and rubbed the front of my car. And when I went to get his info, pulled a gun on me and then took a shot at me. Luckily, they were a horrible shot and they missed. But I should also sell that car because that car is now associated with being shot at in downtown Chicago at 8:30 in the morning on a Wednesday. So
You should also never go to Chicago.
well, I try not to anymore. But, so in these situations, I guess I've made a mistake. I've held on to things that are traumatic, and maybe my life would be better if I got rid of these things and I wouldn't have this kind of vicarious trauma type of experience. Or I can live in my house and I have memories of Susan here and I can still love my house. And I do. And I'm making it my house now. I've slowly and gradually taken the things that were ours. And now I've sold some things in garage sales. I've made donations in her name and everything. And I'm converting this house into my house now. And that car, yeah, it's got a dent in the front on it. Right. You know what? That dent reminds me every day life is precious. I have no idea what's going to happen today. And I use that dent now to keep that in the back of my head.
And just to steal from you, because I don't have any of my own thoughts. She's, Taylor's also trying to not think.
Right.
Taylor doesn't want these thoughts, and it's like, I think everyone listening, if I say that, should be laughing a little bit. It's like, oh, you don't want those thoughts? That's a guarantee you're having those thoughts.
Yes.
And so the goal is to have those, and whatever those bad thoughts are. I mean,
we could do an hour on it if there's such a thing as a bad thought, even as well,
right.
Too.
But I mean, depending what they are, and what you're calling bad, because they're, as you're pointing out, their categories, and at the very least, they're suggesting these are associated with a past trauma. So we're not talking about like, oh, I'm having pedophile thoughts, I'm having these thoughts. They're suggesting this is reflecting a really awful thing that happened to them. Well, Taylor, I would suggest that you need treatment for that trauma. And if you're going to tell me you had treatment for the trauma, I'd say you're not done.
Right.
Because I'm trying to live in a world where something like that happened. And for me to try to push it out so I don't have to deal with it is a kind of denial. I'm trying to live in a world where, like, that's not a part of my life. I don't want to remember it. It's bad. It's over. It shouldn't be there anymore. And, well, I don't get to do that. I have to learn to have that in my life. And, it's probably always preferable to not have a trauma happen. But in what way am I going to learn from it?
Yeah.
What am I, it's like, it's kind of the consolation prize. It can be really horrible and everything, but like, if I'm going to cope with it, that does make me stronger in some ways. And so I have to live in the world where that happened. So I'm wondering whether you need some treatment for that trauma. And, you kind of combined it with OCD, which potentially, if we're going to actually do treatment, really sad. I mean, I'm sorry, but it works well because all those bad thoughts get to be exposure, which we want to do for OCD. And we also want to not only have just exposure, but we also want to have you working on this trauma, which, would require Patrick or I to ask you a million questions about, what might be useful to do to work on that trauma.
Yeah. I had a great working relationship once with someone who was in a car accident. And we did one session in the office, and every single session after that was in a car. And eventually we drove through the intersection where she was T-boned and her hip was broken because she was hit so hard. Right. After that, there wasn't a lot of associations left for her anymore with driving through that intersection. She still remembered it. It was still there, but she overcame that fear and learned that she could handle that very thing. What was her problem prior to that? She held on to a fundamental belief that I would never be able to handle something happening again. And one of the things that I love about Edna Foa and the Dateline video that she did about PTSD, when you're at the end, the person who talks about the trauma that they went through said, the thing that I know now is that this could happen again, and I can live with that. Right there's almost an idea in people's head that I barely got through this thing, and there's no way that I could ever have it happen again. I wouldn't survive it. It was only by pure luck that I survived it the first time, and I better do everything in the world to damn well make sure that this never happens again. And we have no way of actually doing that. As much as OCD may lie to us, as much as PTSD may say there is a way out of ever having this again, that's just a lie told by our brain to keep us doing these repetitive, quick fix things that we do right now. Safety behaviors in these situations are our problem. They are our enemy. And if they actually worked, John and I would tell people to do these 5 things all of the time. Avoid everything you're afraid of. Seek constant reassurance from everyone you know that you'll be fine and everything will be okay. Distract yourself as much as you possibly can if you do have to face a fear. If none of those things work, use all the drugs and alcohol that you possibly can to get just obliterated out of your brain so you don't think about anything. And do a ton of compulsions. That would be what John and I would tell everybody if we actually believe these things worked.
We have a bunch of medication questions, which I just want to lump together. There are a bunch of meds that are thought to be useful with OCD. On the average, they are equal. Individually, it's a crapshoot. So, you might respond to all of them. You might not respond to any of them because, we haven't found the right one that works for you yet. So I don't really, so somebody talking about like, should I do this med or that med? It's a guess. When we talk about like, here's the first choice we would do, not because it's the best one, but because it works on most people with the least side effects. But that doesn't mean it's the best one. That's just a statistical definition. So we don't have like the best drug for OCD. The category of SSRIs tends to be the most useful, but some people that category doesn't work and we have to use other drugs. So your experiences, yeah, if you're going to say this drug didn't work for me, it's like, this drug had this weird side effect on me. Yep, I believe that. One person said, should they say they're afraid to get off the drug? Well, the drug, they're not fixing something. I mean, they're not repairing something. If the drug works, it's quite likely because one needs the drug. If I go off the drug, what will happen? There's a good possibility that some people, the body might go in a phase where it doesn't need the drug, but it doesn't mean it won't ever need it. And some people, they always need to be on the med. So if I'm trying to get off, I would go very slowly, knowing that even if I get off, that doesn't mean I'm off drugs forever. And yeah, I personally might be inclined to stay on the drug myself if I was on one. But it's not unreasonable to depending on what the med is. But with the SSRIs, yeah, for plenty of people, yeah, it's like I'm on metformin for diabetes currently. I do have to watch what I eat, but like, the metformin is going to keep being there. So it's helping something work right, but it's not like, oh, it's fixed, and now I can get off.
Yeah. Hey, John, I want to jump to this one if you don't mind.
Okay.
Your opinion. You ready?
I'm ready.
This past week, I saw a video circulating of a prominent pastor and author asserting that PTSD, OCD, and ADHD aren't real. They can pound sand, as far as I'm concerned.
Well, I think the very prominent pastor's an idiot.
Yeah.
It's really upsetting.
Mm-hmm.
I do believe that he does not have any of those problems.
Yeah.
And so there's certainly many people who, I mean, what really sucks is this guy has no empathy.
Right.
It's like, I don't have this problem. It doesn't make sense to me. Why would you do this stuff? So it doesn't real. And so one would think he shouldn't be a pastor.
These two very prominent psychologists could say we don't think your God is real.
We
So
could say that, yes.
we could.
You know,
We could.
I would be more charitable. I would say he might not be real because he hasn't spoken to me.
Mhm.
Um, but yes, I certainly would have to allow that it's a distinct possibility.
Mhm. And I wanted to bring this one up because these are the kinds of little things that OCD loves to hook and catch. Like, oh, wait a minute. 8,000 people told me yes, but one said no. Maybe that's the one that's right.
Mhm.
Maybe that's the right answer and everyone else is wrong. And this is just a great example of that, where people with OCD will say, yeah, but this pastor said. And so, you know, there's always going to be a detractor. There's always going to be a yeah, butter out there, right? And I want everyone to really keep that in mind, that not everyone will believe in mental illness or mental health diagnoses. Not everyone will believe in physical issues as well too. Not everyone will believe in anything or everything that you believe in. And let's not use that one person as the definitive expert in our life for that thing.
And the same is true in research. I can always find a study or a bunch of studies that say X.
Mhm.
I'm looking for a bigger body of evidence because, somebody might have some counter evidence, but like, what does most of the evidence say? Because when we talk about research is based on statistics. So it's never like we prove anything. Research is literally, this keeps coming up this way. So we think it's probably true. We think it's unlikely this would keep coming up if it's not true. That's as close as we get. Again, everything is the odds. So even if I find some counter research, how much counter research is it? How much does it make sense in terms of, their actual data? How good is the data? Blah, blah. But so the pastor, he definitely has an opinion.
Yep. And opinions are like butts. Everybody's got them and they can all be stinky. So, mhm. That's my statement about that. Well, John, once again, people have spent another hour of their life with us. Any parting comments you'd like to give to the world before we're done again for this week?
I'd just like to thank everybody, and I hope that we're giving quick answers, and of course, we're not curing anybody, but I hope we're at least giving people enough guidance that it gives a little direction and hope.
Yes, I would agree too. That is our goal, to be with all of you. And while we may be funny and irreverent, well, we think we're funny. We may not, but we think we're
Right.
hysterical.
We're entertaining ourselves.
We take this so seriously, and know that our jabs are at OCD, not at any person with it, because
Yes.
we don't like OCD. And we think it is worth ridicule, and it is worth judgment, and it is worth the vitriol that we have for it, because we know what it does to the people who have it. And we will be stalwarts against it for the rest of our careers.
And when possible, humor is one of the weapons against OCD. There are a
Mhm.
bunch of them, but it can be one. So we hope we bring a little of that into your life.
Thank you, everyone. Once again, we'll see you again in a week. Make it a great night, everybody, and